My name is Joy Gay. I'm from Austin, Texas. I'm 68 years old. I was diagnosed with pulmonary fibrosis approximately a year and a half ago. I had extreme coughing, shortness of breath, and talked to a pulmonologist. Then I went to a clinical testing in Dallas, Texas. It's considerably I've deteriorated some from when I was first diagnosed. I noticed that there was a problem was about 2.5 years ago. I have always been prone to bronchitis and pneumonia and things like that almost all of my life, but I got it about like I said, 2.5 years ago, and it lingered, and I was short of breath. Altitude bothered me. It was a constant cough. We wake up in the morning and I would start coughing to the point where I'd start hyperventilating. So I went to my internist and they said, well, it was just a chronic bronchitis. And so I went to an ear, nose, and throat person. I went to an allergist, finally went to a pulmonologist, and he diagnosed it right away. And that's when I went for a second opinion, and they also said that it was pulmonary fibrosis. I was having more shortness of breath at that point, rapid heartbeat. They told me that there was really no diagnosis, there was no cure for this, and there was really no medication I could take. And that I could either expect a steady decline in my health, such as more loss of oxygen, less energy in anything I was doing, loss of appetite, obviously weight gain because you're not getting any exercise, so I could go for long periods of time and stay stable, and then I would drop drastically. That's what happened to me, is that I would stay there for a while and then I'd drop down. And again, it was the decrease in energy, the decrease in my air intake, rapid heartbeat. I've got high blood pressure, so that all came into fact. I think the thing that bothered me the most is the fact that I could possibly have a heart attack. Your heart beats faster trying to get the air into your system. Also, it forces you to get out to find out just exactly what the disease is that you're dealing with and the realization of what you have to deal with. So this is what really forced me into looking at something that's alternative, such as stem cell replacement. Looked into stem cell research and found the clinic and came here and could not say enough good things about the clinic itself. They are extremely efficient. They know their work, and we were greeted at the airport, and from then on it was in their hands and not in mine. So I am on my way home after a successful session. I will be back for the second session in approximately 90 days and have very high hopes of what's going on. They're very positive here in their treatment and their method of working with their patients. And I found out about them. I really can't say when it came up in my mind about stem cell replacement. I think it was kind of somebody suggested it. I got on the internet and started looking for it, and happened to find a broker that advised me to use the clinic here in Tijuana, and I'm certainly glad I did.
Ross. I'm Joy's sister-in-law, and in regards to her diagnosis of pulmonary fibrosis, it's been a concern for us. As far as the severity of the disease, it's actually been something that's been kind of quiet. She's informed us about the progression of her disease, but until this past Thanksgiving, we were able to really witness the severity of her disease. She was at my home for Thanksgiving, and we were there to witness the extremeness of her disease, the shortness of breath, the cough, and just how debilitating she, was after an episode or the crisis that she had. I see this to be very promising in the regards because I also see some tendencies in my husband. So I don't know if this is a familial thing, but I have high hopes that this will be something that will be of benefit to her especially, but in the sense that if it does pass on to the family members, that it will be helpful there too.